Hi, everybody. So today we will have Dr. Sheila Chang Barbarino on our live IG today. And the great thing about having at the international panels with lots of experts is they are very fun people. And can't wait to actually introduce one by one. We have fun people like Sheila, we have Heidi from yesterday, Rang Sima, and there are a lot more coming up in our IG Live soon. So I'm still waiting for Sheila to get on board, and then we can start very soon. So I think I found her. It's started off doing ophthalmology. Hi, hello.
Hi, how are you?
Good, great seeing you.
It's good to
It's
see
been a while.
you.
Yeah, it's been a while.
It's
We
been too long.
I miss all the fun with you.
I know. How have you been?
Good, surviving. The clinic's closed for about 3 weeks now, so I'm not doing anything except like trying to get in touch with all of you. And
I love
yeah,
it.
I've seen you've been working out a lot
For
more
the
these days.
first time, I'm really working out in my life
Yeah?
on a
What's with
normal
the
basis.
okay? What's with this magic mirror they're using? Like you,
Yeah. So it's like the Peloton it's for women and men, but it's kind of like the
I'm
women's
sure.
Peloton. Have you heard of you guys have Peloton, right?
No, I haven't heard of it. Well, what's that about?
So it's a bike, like it's biking. So it's a
All right.
stationary bike, and you do live videos with.
Okay. Right. And
So
you've
the
been doing
same
that
thing
with
with
that.
like,
You were showing the mirror, right? And
yes,
and you were actually watching and doing it together.
yeah. And so I
All
can
right.
actually get personal training like right in my own house. It's fantastic.
Nice. Fantastic. So yeah, so I know you started off doing ophthalmology. You're doing eyes and ears, and then
Yep,
later on going to ocular facial plastic, right?
right.
And you are currently based in Austin. You have two practices?
Austin and Los Angeles.
All right. And now Los Angeles has been one of the earliest heat at the shore.
Yes.
And how are things there?
So it's been really crazy. So we've been shut down here in Austin for probably about since March 18th, I think the date, and Los Angeles was the week before. But
Okay.
the problem that I face is that I go once a week to, once a month to LA, and then three
Right.
weeks here in Austin. And so traveling back and forth, they stop that. And so if you
Yeah.
go to Los Angeles, I'm not going to be able to come back here. They ask you to self-quarantine for 14 days. So
Yeah.
I had to cancel all my surgeries and stop seeing my patients. And then they shut down all the clinics there too anyway. So, it was,
It is for the better, right?
it
We
is.
never know. Some of them might come asymptomatic and they could pass it to one of staff, and then later on we become a vector.
Absolutely.
So I think it's great that we are doing our part. And I know in United States, in the initial phase, there were a lot of issues about the Asians, or there's a lot of
Yes.
xenophobia and stuff. You have the Asian look. I know you have a mix.
Yep. I'm half
What's
Chinese.
what's
I'm half
your mix?
Chinese. I half Chinese, half Italian. So,
Right.
because I was really raised by my Chinese family, so I think of myself as more Chinese. So,
Right. So you have
I
the Tang. That's your last name, was it?
yes,
Oh,
yes,
okay.
that's where it comes from. Exactly.
Right. Right.
So, no, I think that there's a lot of fear of, especially here in Austin, we've been getting a lot of emails from the Texas Medical Board. The population of Asian Americans here in Austin is very small. It's probably about
Mhm.
3% of the entire population, which is obviously much different than Los Angeles. Um,
Right.
so, at first there was a lot of fear because a good percentage of the doctors are Asian here, and a lot of the
Right.
tech companies hire a lot of Asians
Mhm.
for engineering and for tech and for everything else. And there was a lot of hesitation because they, wanted to know if they had recently been home visiting family or if they had any family that had been traveling. And so it was very concerning for the population here in Austin.
So there was news about people holding guns, especially Asians, to protect themselves, and they are beaten up.
Oh my gosh. So
Is that true?
you have to understand, I'm originally from Los Angeles. So
Right.
Austin is now my home and I love it, but it is a
Right.
whole nother world. It's so fun and so interesting, and every day it's a different venture. So I was talking to my friends and and doctor friends in Los Angeles,
Right.
and first because obviously they went into shelter in place before we did here in Austin, and
Right.
I said, oh well, what are you guys doing so when it happens here then I'm prepared.
Right.
So I was talking to some of the other KOLs, such as
Right.
as yourself, and kind of figuring out what was going on. And they were saying, oh, we're going to start stocking up on food, on toilet paper. We're going to start stocking up on medications. And
Right.
the minute we started thinking it was going to happen here in Austin, everybody, they're like, I've got my guns, I've got my food, I've got my animals. And it was so funny because it was such different, of course, I'm hoarding antibiotics like all my friends in Los Angeles, and they're like, what's gonna, I remember the day that I was the last day before we closed down in Austin, and I got a phone call from a gentleman going around the area that I have my office downtown, and downtown Austin is like very fun, very hip, very upscale. And the first thing they asked me was, what I like to have my practice boarded up, so in case anybody goes to loot the practice. And I said, oh my God, are we worried about that? And so I locked the lasers in a room, and but it's a different, everyone's really worried, obviously everyone's really concerned. I think that we didn't take precautions in the United States as we should have sooner rather than later.
Right.
Obviously we're seeing all of that in New York and Los Angeles and Washington and all those states that are really being hit hard. I think that for Austin, I really saw it come much later because we didn't really think that we had it here, but we were, like you said, we were kind of lying to ourselves because we didn't get the tests done early enough, and we didn't know, so now, knowing is not necessarily, not knowing, ignorance is necessarily the best, especially in things like this.
But maybe there's not a lot of Asians in Austin, but it's a big population of Asians in Houston, right? In Texas.
Yes.
And do you think that people are more concerned over there? They are wearing masks all the time, so it's not spreading? Or
everybody here, it's interesting to me that I was talking to one of the physicians here in Austin, and they said, I don't remember what it was, but basically they came to my door to pick up something, and they said they came wearing a mask, and I said, oh, are you having symptoms? And they said, no, it's to protect me in case if you have it. And I said, that's totally a misconception. When we wear masks, we're protecting everybody else from getting it if we have it. We're carriers and we don't know.
Right, that's correct. And is it now more commonly people are actually wearing masks all the time, or it's still kind of
everybody's wearing masks and gloves? I think I'm the only person, and now I feel peer pressured to wear it. I have actually been tested. I didn't have symptoms, but I was able to be tested, and I was negative, and so and I've been very cautious. And but I do think that moving forward, after all of this is said and done, I think all of us are going to take personal hygiene to a whole new level. My husband and my friends are like, I've never washed my hands like this ever.
Yeah, we wash hands more often than usual right now.
Well, you and I do it all the time, but physicians, right? But a lot of
Exactly.
people are like, I've never washed my hands longer than 5 seconds.
Yeah, indeed. So you say you get tested. Is it because I heard a lot of people out there, even ourselves, we don't really have the test kits available for us.
I'll be honest. The reason why I was tested was because I got back from Los Angeles and
Uh-huh.
I was still seeing patients, and I wanted to make sure before I started seeing patients again that I was negative. And
Sure.
so, yeah.
Yeah, and did you go for the IgG IgM test, or did you go for the viral the RNA test?
No, it was just the swab.
Just well, yeah, probably the PCR RNA
Yeah.
test. Yeah,
I
yeah.
still wore the masks to see the patients that last week before they shelter in place and everything. But
Right,
like I said, because I had just been, as Miami, Las Vegas, New York, and then Los Angeles, all the places that had been hit. And
right.
there was a lot of people that, they're international conferences. So I'm seeing a lot of people from out of the country.
Yeah,
God forbid, I wouldn't want to be the person that's giving it to all of my patients.
yeah,
Right?
exactly.
It's just bad form.
I know. Yeah. So basically, your practice, it's you stopped practicing since last week, right? A week
Yeah.
ago, or yeah.
Yeah. But no, the 18th.
18th, yeah. So, what do you think? When could you open again? Are you planning to do it anytime soon, or you probably wait and see until that's more clear
I keep
instruction?
hoping that, I don't want to, obviously the reason why we're doing this is for a real reason. And, I don't want to be that one, person that pushes everybody to go back to work and then,
Sure.
God forbid, everybody get it. So I was hoping to go back the last week of April, but the governor of Texas has pushed that to the 1st of May.
Okay.
I hope that's the last delay. How about you?
Well, we're supposed to start next week, but I have a feeling that with the numbers, we might extend another 1 week or two. They might release a little bit, not as strict as right now. But yeah, it's a lot of uncertainty right now. We just don't
Crazy,
know what's
right?
gonna happen. It's crazy.
I don't
Yeah.
know when to book patients. Patients are, do we start in June? Do we start at the end of May? I'm not sure what the
Yeah.
answer is. It's crazy.
Yeah.
Do you know anybody personally that's been affected by?
I've heard of yeah, I have a few friends who got it, and we know there are some
They
common
tested
friends.
positive?
Yeah, yes. And I think they are going through it quite tremendously, and they are recovering, which is great.
Yeah.
But and one of the friend who say that he's almost at the verge of dying, and I was like, wow, okay.
Yeah.
And he has asthma, and
Is he
that
young?
in the 50s, 60s, I think. Yeah.
Yeah.
So I think that is something that we are very concerned about, especially if it happens to our family. God forbid. Yeah.
God forbid. Yeah, totally. I know one friend of mine. He's young, yeah, super healthy guy. He's in France and he was hospitalized, but he's now being discharged and he's getting better. But fortunately, I don't know anyone personally. There was one guy that my husband works for him, and he thought he had it, but thank God his test came back as negative. So,
Okay, thank God.
yeah, right.
But we just never know. Sometimes if we test it too early, it might not come out. And then that's a worrisome. How many times do we have to do to sort of make sure? Just like HIV test, that's a window, and we always
Yeah.
say, okay, the first test is negative. We probably have to do a second one just to be sure about it. And probably that is something that we also need to look into.
How
And
do you
talking
feel
about
about these people donating their plasma for treatment?
yeah, that's someone say I love you, Sheila, over there.
Oh, I love you too, Armando.
So how's the
Armando's
testing?
my makeup artist extraordinaire. He's amazing.
Oh, okay, right. How's the testing and contact tracing going on in Austin or the whole Texas or in United States?
Wait, say that again.
How's the testing? Is everybody? Is a lot more people get tested,
Yes,
and a
so
lot more.
they're shipping and tons and tons and tons of tests. So hopefully everyone's getting, you know, tested that feels sick. You know, the problem is that, you know, I posted kind of a funny post the other day that, you know, it's a dog and it says, you know, every tickle in your throat, right? It's like, you know,
Right.
is that Corona, right? Everybody. And so, you know, at the time that when I came back from, you know, traveling everywhere, you know, obviously there's allergies, I'm run down, you know, it's so, you know, who do you test, who do you not? It's tough, right? Do they have to have do they have to have a fever to test? Do they have to just have respiratory symptoms? Do they have to have, you know, cough? You know, it's, and right now, believe it or not, it's high season for allergies in Austin. So all of us are like,
oh my, that's not good.
No. So what are you getting delivered? Are you getting food delivered all the time? Are you
basically. Cooking? Yeah, no, it's basically, it's a little bit of cooking and a little bit of deliveries going on. Yeah, and then we just couldn't go out. We just stuck at home.
Are you going to the grocery store? You're not going out at all?
Hardly. I just get everything delivered. Yeah, it's much safer.
Yeah, no, you know, I was just telling my husband, I said, you know, because I've been talking to a lot of the KOLs, and everybody says, you know, they're not even going to the grocery stores anymore. And I still have to go to the grocery store here in Austin because I can't, every time I go on to get delivery to groceries, it's like 2 weeks, 3 weeks from now, I can get them delivered. I'm like, by then, like, who knows what the heck's gonna happen? I don't know if I'm gonna even like want that food by then.
Right. Do you stock a lot of food at home then?
So yeah, because every trip to the grocery store is like, you know, it really feels like The Walking Dead, you know, like the post-apocalypse. You know, you go there and, you know, all the shelves are depleted. All your favorite things are, you know, depleted. You don't have kids, do you? Not yet?
No, I don't, yeah.
Okay, so when you do, I have a 6-year-old. And for those of you who have kids that are, I have a 6-year-old boy, and he is very particular about what he eats. And when they don't have what he wants to eat, it gives me a panic. And so, you know,
that's a lot of work, yeah?
Yeah, no, it's, you know, but, you know, you have to remember, it's like, you know, the toilet paper for weeks was gone from here, from our shelves. So, you know, all of us are stocking up, you know. I can honestly say I went to the grocery store 2 days ago, and it was the most social thing I've done. You know, I think that for you and me, for people that like to be talk and hear out people, you know, obviously we've kept our distance and everything, but waiting in line to get into the grocery store was like, wow, there's still people alive, thank God.
Was it comforting for you? It's like wow, okay.
Yes, yes. My husband's like, I took a picture of the line, and it was probably 20 people in front of me and probably 10 people back of me, and he's like, oh, forget it, like, just come home, like, don't worry about it. You know, you'll go in the middle of the night or early in the morning, you know. And I said, no, it's actually kind of nice.
You actually loved it.
Yeah. You know, to, you know, watch everybody interact, you know, and even though we're not talking to each other necessarily, we're still 6 feet apart. It's nice to feel like people are still, you know, around you, even though they're in their houses.
Yeah, but are they doing physical distancing? So they're
everybody.
Okay, that's good. That's good. So we know that out of 1.5 million, you have friends there. Out of 1.6 million people who actually get tested.
She's my she's amazing.
She's your. Oh, I think that's no, that's a little bit lag. Yeah. You were saying earlier, she's your.
Dee Winner is my business manager, and she is a huge supporter. And so she was like so excited that we were doing this TingSong. So thank you for organizing.
Hey, my pleasure. It's fun to have you. And currently, we know that in America, there's more testing going on, and the numbers have increased, but also the mortality rate is increasing as well. And there's a lot of talks about disparities in terms of people getting treated. Is that the same in Austin, or what's happening?
Yeah, you know, I think that right now we're still okay. I think everyone that needs to be treated is getting treated. To my knowledge, I'm not on the front lines. I applaud everyone who is, but for right now, I know that everybody's being treated. It was funny. I actually was talking to my office manager in LA, and she was saying that UCLA is actually they're not overburdened yet because everybody's going to the other hospitals because they think UCLA is so packed. So it's kind of the reverse, right? So
right. Oh, that's
so
good.
if you're in Los Angeles, go to UCLA. Everybody ready.
So so you have your business manager over there. So how's business gonna be? What's your strategy? Yeah.
I don't know. I think that originally when LA shut down, we were going to rejigger and then send everybody out to Austin to help me and just kind of double book the office here. But, then we shut down here. So, I'm spending this time, every time you have to make valuable, right? So I'm, finally publishing those papers that, we always talk about. And then we should write a paper while we're
Yes, indeed.
Yeah,
I've been working some as well right now. Yeah.
Yeah, no, it's a really good time. It's good. I was talking to one of the head of medical affairs of one of the companies. You've met her, Deanna, and she's just so overwhelmed because I think everyone had that same great idea. But I'm taking this time to really, number one, all the things that you want to do in your practice that you don't have time to do, which is great. It's a good problem to have, but rebuild my website that I've always wanted to kind of, shake up a little bit. And because we've been so busy traveling, speaking, teaching, we really have time.
Yeah, indeed. And in fact, this might come out as a positive thing because we never really had a time to sit down to do things that we really wanted to do. And then this is a time to recuperate, and then we can actually really sit back and think forward, right? Yeah. To do things that we want to do.
Well, I can honestly say there was a paper that I've wanted to publish for a couple of years, and it's completely done. I just, to submit it, it's just, but I read it over, and, I thought it was done, and it was perfect, and all this, and I read it, sat down, and said, well, that's not as good. So it gave me the time to really, take a breath and say, can I make this better? And it's going to be much better than I thought it was going to be. So that was really good.
Oh, so can you share what are you working on? Like what kind of stuff are you working on right now? So
there's a couple temple paper. There's an Ulthera paper, the dilute Xeomin. I'm hoping to finally turn in. John Feza and I are working on a vascular occlusion in how to deal with it if you're not an ophthalmologist or a retinal surgeon, which I think is really timely and important today, in today's climate. What are you doing with all your time?
Well, I've been taking up a little bit of yoga. I never really tried. So
really?
This is
Are you flexible?
No, not at all.
Me neither.
No.
I'm going to show everybody how not flexible Dr. Barbarino is, just to make everybody laugh. I can't touch my toes.
Okay.
So maybe by the time we have the end of we should have another one of these at the end, and then maybe I'll touch my toes.
Do some exercise. So what's the plan? So you talk about trying to revise to kind of do something about your practice and anything that you have in mind that you want to do. Yeah,
so obviously I want patients to feel good, when they come back. I want to make sure that they're safe when we come back. So, I'm taking extra precautions. Obviously I would love to make sure that the staff gets extra training now, that I've had quite a bit of staff for a long time, and I think that we've been so busy, it's like drinking from a fire hose, and I'm always like, and then when you're done doing all the charts and everything else, I want you to log online and do some CME, and learn more, and now
Yes.
I can actually do that, and so I think and everyone's been so gracious in doing a lot of the CMEs for free online and the live,
Yes,
webinars.
yeah, and I think it's gonna be more to come. Like yeah, like this few days, there's a lot of talks about having webinars here and there. I was like,
Yeah,
April will be full of webinars.
it's a
April and
webinar
May.
April.
It will be
It's
a
so funny.
webinar.
I don't think I ever really used. What are you guys using? Zoom or?
I think here, yeah, people love Zoom because it's easier to use, and you can, if you subscribe to, you can have 1,000 people in the room.
Oh my gosh, we
To
should do that. TingSong.
oh, we should get everybody
Yeah,
and
let's get
sort of
1,000
go on a
people
Zoom.
and do a Zoom.
It will be a max. Did you get? I got an email today. I think Terry sent it and saying Max gonna postpone to 2021. Eh?
Mexa says?
Mm-hmm.
No. I live
They
for
are.
Texas. If anyone from MERS is listening, I live for Mexis. Do not cancel Mexis. It's the best.
We should get everybody and do a Zoom together. That'll be fun.
Yeah. No, let's do that. Let's make sure we do that before we all go back to work. I think that's
Yeah,
the
exactly.
goal.
Exactly. And do you ever actually consider doing a virtual consultation with the patient? So
I started doing.
there's a lot of talk about virtual consultation, like going online to do consultation or like a FaceTime to do consultation. What do
I
you think about
started doing them. I think that they are. I'm having good and bad luck. So I feel like some people understand the concept of having a virtual consult with me. It's a time that we can talk while I'm not in the office, and it could be as if you were seeing me in the office. And some of that's working. I think some people misconstrue it and kind of say, oh, because my other doctor isn't doing consults. Let me ask Dr. Barbarino about this problem that they've been treated by another doctor. That's not what a virtual consult is for.
Yeah.
And so I think that kind of confused people a little bit. How are virtual consults? Are you doing virtual consults?
Well, we didn't start anything yet, but we started having some consultation that goes online. We do via the WhatsApp. But I think there's a lot of limitation to it, and I think it will take some time before it actually would be comfortable, because our work is more person to person, and you really have to see them. You have to somewhat touch them as well,
Yes,
just to make.
I always put my hands on the patient.
Right. So that will be difficult. That will be difficult when we could go back to our practice. That's a lot of things that we have to consider, not to spread, not to get ourselves infected, and not to spread infections to others.
Do you have enough masks to?
We have enough masks at the moment, but we do, if we continue to practice and use out a lot of masks, I think we probably would have a shortage. But I think now with China, they are going back to normalcy, and I think then with the factories and the masks, we probably can get back enough numbers of it. But I'm thinking that we need to have a face shield at least to protect, just in case, how there's a lot of articles out there saying that you can even like breathe, and then there are like particles spreading all around.
Yeah. The aerosolization is all. It's what it's all about. There's a couple ophthalmology recommendations. The same thing, that they want us to use face shields when we examine them with with our ophthalmoscopes and all of that. I don't examine with an ophthalmoscope anymore, but I think the recommendation still should hold. And definitely use a shield.
Right. Any particular recommendation that you guys will do, especially with treating eyes, because that's mucous membrane.
So I didn't even really think about that until I read some of the articles that came out of China and Italy, as far as recommendations, and I would definitely wear eye protection, which
Right.
is not something that people are doing, right?
Yes. Yeah.
You see everybody in gloves, a mask, but nobody's wearing any eye protection. And, you know, like you said, the aerosolization is also going to spread and perpetuate the, you know, infection.
Right. And would you wear a specific mask, or would you just wear a surgical mask and that's about it?
Oh, that's a good question. You know, I have surgical masks. I ordered some of the tighter fitting masks. You know, the N95s are impossible to get right now.
Right.
As far as masks in general, I can't even really order anymore. Everybody's back ordered. So, you know, I have what I have, and, you know, I'm going to try to stay as protected as I can.
Yeah. But one thing about this N95 is it's so uncomfortable. You can
I
you
haven't
wear
even
the
worn
whole
one.
day. I used to wear that when I was working with TB patients, and then it's horrible. If you wear the whole day, you have a mark over here, and it's painful.
Yeah. Yeah,
Yeah.
I bet.
So, yeah, I think a reasonable face shield that covers all the way down perhaps can protect patients and ourselves. So in a way, when we talk, it just kind of have a shield, and then
Yeah.
yeah, I think that will
You
work.
have to have like the whole thing, like the steel
Yeah.
workers,
Yeah.
right?
Maybe we should have another shield in front
Oh
of
my
us.
God, we should patent that. Everybody listening out there, don't copy our idea. We're gonna make millions.
Oh my, it's always fun talking to you. Thank you
It's
so
so
much.
great to see
Yeah.
you.
Oh, well, if Max is not happening, let's hope for some other chances that we can meet again.
Yes. So
Yeah.
when you're not sure when you're gonna get back into your clinic?
Well, I think today they will do an announcement whether they will extend or not.
Have the numbers gone
Typically,
down where you are?
well, it seems that it's being controlled in certain ways, but you know, you can never let loose. Even China, when they're actually sort of the lockdown, even after the lockdown, they just kind of release it a little bit by little. And the problem is, here we have lots of Muslims, and Ramadan is coming, and you know, Idul Fitri is coming, and the problem is when you have gatherings, and then you have the second wave, and then you have third wave, and it's never ends.
Yeah.
And probably we have the lockdown for the full year. That I don't know how it's gonna happen. It's just crazy. But
Yeah.
hopefully everything will come down, and we can sort of go back to well, probably not the usuals, but a new norm. We really have to. Even now, I get a little bit. You know, the first day of the lockdown, and because I Contagion, that you know, this show, this movie
Yes,
Contagion,
of
everybody
course,
said
of course. Yeah.
don't watch it, it's so scary. And I decided no, I really, since I have the time, I went to watch it, and it's like, oh shoot, yeah, that is scary.
This could actually happen.
Yeah, yeah. So from now on, I think like everything you touch, you probably just like, okay, let's wash our
Yeah,
hands. Let's
right?
sterilize ourselves.
You know, my 6-year-old's like that. He's totally freaked. It's so weird because, you know, he's watching all this YouTube and, you know, right now we're trying to homeschool, right? So, but I'm trying to still get things done. So every
Right.
once in a while, I'll let him get on the YouTube. And right now, everybody's talking about how to stay safe with the corona. So my kid is washing his hands, and I'm like,
You used to have to nag kids to wash their hands. Even ourselves get nagged like, oh, go wash your hands before your meals and
yeah,
everything.
no, he's like, it's awesome. Like, let your kid play a little bit with the YouTube, and he'll freak out, and by then you won't have to ask him to wash your hand ever again.
Well, I guess that's a lot of good things coming out from this COVID-19 ban, right?
Yeah, it's so good to see you.
Likewise. So we
All
keep
right.
in touch. Thank you so
Yeah.
much. Yeah, I send you a video after this.
Yes. All right. Take care.
Okay. Take
Bye.
care. Stay safe. Bye.